अस्सलाम वालेकुम, वेलकम बैक टू माय चैनल। आज की इस वीडियो में हम डिस्कस करेंगे एमसीक्यूज ऑफ लोअर एक्सट्रीमिटी स्ट्रेन्स एंड स्प्रेन्स। प्रॉब्लम नंबर 1, a 21-year-old woman came to emergency department after twisting her ankle while jogging. She tells that her ankle rolled in at the time of the injury and she says she has pain at the right ankle. She is able to walk without any resistance. On examination, there is minimal ecchymosis and swelling on the lateral side of her right ankle. There is pain with inversion of the right ankle. Ankle tenderness is maximal just anterior to the tip of lateral malleus. There is no actual bone tenderness. There is no ligamentous laxity. MCQ 1. The injury in this patient is most likely which of the following? Answer is grade 1 sprain of anterior talofibular ligament. What ligament is most likely twisted in this injury is anterior talofibular ligament. What is the treatment of choice in this patient is weight bearing as tolerated with active range of motion exercises. Problem 2. A 26-year-old football player hit on the lateral side of knee is brought to the emergency department. His ankle buckled and is now in severe pain. On examination, there is swelling over the medial aspect of left knee. There is laxity when a valgus stress test is performed. The result of Lechman test are negative. What is the most likely injury in this patient is medial collateral ligament sprain. Based on your diagnosis in question 4, what is the initial treatment of choice is knee brace. Problem 3. A 22-year-old man is brought to the emergency department 8 hours after twisting his right knee while playing in a soccer match. At the time of injury, he felt a sharp pain on the inner part of right knee. He is unable to straighten his knee fully and is to be carried off by the teammates. On examination, there is moderate joint effusion, tenderness at the medial joint line, and limitation of last 20 degrees of extension by springy resistance. There is sharp anterior medial knee pain when passive extension is performed. When passive extension is forced, Lechman test is negative. What is the most likely diagnosis in this patient is medial meniscus tear. The radiological procedure of choice to confirm the diagnosis in this patient is which of the following? MRI scan. What is the definitive treatment for the injury? What is the definitive treatment for the injury to this patient is arthroscopic surgery. Problem 4. A 23-year-old woman with right posterior thigh pain is brought to the emergency. She was running a 100-meter race when she felt a pop in her right thigh. On examination, there is tenderness over the mid portion of right hamstring muscles and pain with resisted stress testing. There is mild swelling and bruising. There is no bone tenderness and no palpable defect. What is the likely diagnosis? Is a right hamstring strain. What is the initial treatment of choice for this patient is ice rest, elevation and compression. Problem 5. A 16-year-old girl who injured her right knee while pivoting is brought to the emergency. She collapses to the floor in severe pain and is immediately taken to the hospital. She arrives at the emergency department approximately 45 minutes after injury and her right knee is already very swollen. Laxity is normal with anterior draw sign and Lechman test. What three structures are involved in the unhappy triad is anterior cruciate ligament, medial collateral ligament and medial meniscus. MCQ 12. The diagnosis of anterior cruciate ligament injury is best confirmed by which of the following? Lechman test. What is the definitive treatment of choice in this patient is reconstruction surgery. उम्मीद है ये MCQs आप लोग के लिए हेल्पफुल रहेंगे. थैंक यू सो मच.